untoward or unexpected certain events. Thank you, sir.
Thank you, sir. Now I go to Kim, sir. If we talk about this resilient future, Professor Bal has highlighted the preparedness, right? Preparedness and adaptability to any situation. So in your perspective, and being a representative of a government also, what is your perspective on the resilient future? What are the factors required for the resilient future?
Thank you for the very nice question. Already Professor Bal highlighted what resilient is. But in terms of the situation in our context, I will highlight some examples. For example, if the disaster happens, for example, in our Himalaya, and then if there is burst, then what we do? We are really unprepared. We haven't educated to our community, to our society. Like in Corona pandemic, we were fully unaware about the pandemic. Similarly, if some things happens, we have many examples. If landslides happens, what's our level of preparedness? I think whatever the situation happens, whatever the disaster happens, we are just, it's a kind of little bit management, but in terms of preparedness, in terms of regaining into original situations, we have so many challenges. But in terms of preparations, contingency plans, yes, we have nice documents, nice papers. But in order to respond very quickly, for example, let's take simple example, road traffic accident. What happens after road traffic accident? So many accidents happening. But in terms of, regaining into, adapting the situations, we have so many lackings in terms of providing care in the hospitals, in terms of being prepared in the traffics, so many things. So I think it's very, very important to be aware, all the members, all the stakeholders, what we are working, not only in one field. I'm from the health sector. The health sector alone cannot work in terms of being resilient. A lot of efforts we need, multidisciplinary, multi-sectoral efforts we need. I'll
come to that point in collaboration. The COVID-19 pandemic, we got control over COVID-19 because the coronavirus in Nepal cannot collaborate with coronavirus in USA. But a scientist in Nepal can collaborate with a scientist in USA. So collaboration is very important while fighting with any calamities, any pandemic, right? So in such situation, human is very unique in terms of collaboration. We can collaborate very effectively. So I think one of the factor for a resilient future is how strongly we can collaborate, how widely, how deeply we can collaborate. So in collaboration, since Dr. Bal, you have worked in academia for a very long time, and you have worked in industry also very long time. So what is the condition of collaboration between academia and industry? And I'll come to you for government and academia, and I'm coming to you for academia and industry, please.
Thank you, sir, again. About the collaboration that needs to be in place between the academia and industry, as you rightly mentioned, there needs to be a very close cooperation or tie without which we cannot be resilient, we cannot build resilient future as such, right? And this academia and industry, these two entities, they have their basically expertise in different areas. While the academia is the powerhouse of knowledge, where basically all the innovations, all the research can happen, it is the industry which actually basically provides us with the real world problems to solve. So that's where I believe that there can be a very good collaboration between the academia and the industry. We would need to basically sit together with the industry people, from the academia, sit with the industry people, and then also, it would be a nice thing. It would be a nice thing if the industry, for example, could sponsor or some of their employees, for example, in achieving certain academic degrees like masters by research or masters by taught course or PhDs, so that these scholars basically create a setup or environment in the academia whereby the real world problem from the industry is being solved. And but then yes, there are challenges as well, because most of the time it's about the intellectual property rights on the data sharing, how do we share these property rights and so on. But I believe that that is something that we can easily sort out, right? And as in the case of Kathmandu University, for instance, we have been trying to minimize this academic industry gap, which we basically talk quite often. In that, we basically include these industry people or representatives in our subject committees as well, so that our curriculum are basically up to the mark, and basically they reflect the market requirements, industry requirements. And at the same time, what we also do is basically sometimes, basically in the fourth year, we have this long 8th semester, we have 3 months of internship, whereby basically our students go to the industry and spend their time, 3 months working in the industry. We release these students, our students, full-time from the academia and all the obligations, so that they get to know the environment in which they work, the real problems of the industry and the real world problems, and how they can translate the knowledge they have acquired in their 4 years of time in the university to solve the problems in the industry. So that's some modality of collaboration that we have been trying. We have been practicing between the academia and the industry. We are also trying to basically, sort of create some other modalities with the government as well, because I believe it's without that modality to be incomplete without the government in the place. So it should be more of a tripartite, I guess, collaboration between academia, industry, and the government. We are also trying to collaborate with the government. We are also trying to hold talks with the government and meet frequently on these different issues.
And one supplementary question. We have many disciplines within academia also, right? Yes. So since you are working in NLP, yeah. So that's quite, as I see from outside, it's quite interdisciplinary. So what is the status of interdisciplinary collaboration in Nepal? Is it good, bad, okay? So, and what should we do?
I would say, basically, I've been working in the latest project that I'm working on is this machine translation project, which we have been funded by Google faculty research, and that is on 3 languages, trilingual. That's English, Nepali, and Tamang. So what we aim to do is basically we would want to develop an independent machine translation engine, so that, it's not just Tamang. There are 124 languages in Nepal, so Nepal is a fertile ground for language research, right? Language technology research and development. So at the end, the ultimate end, we aim to basically, develop an independent machine translation system, a framework where we can add other languages of Nepal besides Tamang, or that could be Newari, it could be Gurung, and this could be so on. So in that front as well, we have very good collaborations with the Central Department of Linguistics, Tribhuvan University. They basically contribute to the language or linguistics part, whereas our department basically contributes on the technology side. And then what we are still further doing is we also want to take the input from the community side, because at the end it is the community which is going to basically use that technology. So for that we are trying to contact the local communities, the local governments, and get their actual requirements as such in terms of developing that technology. So that way we are trying to basically trying to create a synergy of collaboration between the government, local government at least, and academia and some part of industry as well.
Okay, thank you. So in academia, we always complain that the government does not collaborate with academia quite often. While doing any kind of research, any studies, government agencies rely more on NGOs, INGOs than on academia. That's our complaint from academia. So how do you see the collaboration between academia and the government so that we can synergize our effort to solve the problems we are facing?
Thank you so much. The second nice question. Yep, there should be good collaboration, and there is no option. We have the problems, challenges, many issues, and government is there to respond, to provide the services to the public. And then in order to make the efficient and effective solutions to these problems, academia is there. But I commit, there are gaps. There are so many gaps from both sides, maybe from three sides. There are gaps. We have to reduce these gaps. We have to bridge the gaps. There are many options we can work together. We can provide very valid questions to the academia, and the academia can generate very best solutions. We have to collaborate. So this is the very nice example, Gandaki University. There is the linkage with the government. And then, as Bal sir highlighted, the industry and other actors are equally important. Yes, we are very poor and there are international supports. We should not follow their priorities. The supporting agency, they should follow the government priorities. So let's work together, and then to be resilient and to be efficient, effective solutions to the community, we have to work together. From all these partner side, so there are certain gaps. Maybe these type of conferences will help us to bring together and respond our problems and become resilient for the future generation.
Okay, thank you, sir. So I come to Dr. Bal. So we talked about the collaboration, interdisciplinary collaboration between industry and academia. And for resilient future, we need a collaboration. That's networking of mind, right? So increasingly, so since you are working in the field of artificial intelligence also, we have seen the advent of collaboration between machines. So there is a network of machines, a very strong network of machines. So these network of machines sometimes feels like they are replacing the network of minds. Right? So be it in social media or be it in any internet world, right? So the network of machine is replacing, or is it not the case? Please clarify. The network of machine, is it replacing the network of mind? So that's my question to you, sir.
Thank you. Very interesting question. I mean, Sometimes we feel we are in a scary situation whether the machines are dominating humans or replacing us totally, and there has been some let's say much of a discourse whether AI will take away human jobs and so on, right? But what I feel right now is, what I feel at the moment is, as a professor of AI, and somebody doing research in AI, what I feel is that there are, among the different stages of artificial intelligence, we are currently just addressing the weak AI part, just basically focusing on some specific solutions as such. Because I mean, the ultimate thing would be super intelligence or general intelligence, but I think we are a little far away in that line, in that direction. So basically what happens is that, so ultimately these intelligent systems are basically designed and developed by humans. So basically what we need to do is, it's fine that we are basically solving some specific problems, like let's say speech recognition, or handwriting recognition, or machine translation, and so on and so forth. So these are some of our specific problems which we are solving through the help of AI, and we are basically, with the help of AI, we are trying to make our lives easier. We are, and it's just the case. It's not the case that, I mean, basically right at the moment we need to be that scared that humans' jobs will be lost. Yes, certain mundane jobs will be replaced. Basically, we wouldn't want to spend lots of labor when that it could be done in minutes or seconds by the machine, right? So I think while the machine would be basically utilized efficiently by humans for doing certain jobs, the role of humans would be always there, in the sense that we would be basically doing some more qualitative work, more quality work, in designing more efficient machines, in designing more labeled data, for example. Because without data, I mean, AI, we cannot imagine AI without any basically supervised data or some sort of quality data. And data basically is noisy. That whatever we find in the internet, that data is noisy. And that needs to be refined, and that needs to be basically, looked into more minute details with a lot of attention and so on and so forth by humans alone. So there comes the play of collaboration between humans. There comes the play for networking between humans and human minds and so on, so that we develop more intelligent machines in the days to come.
So are these machines making us more resilient or less resilient?
I would say that I'd put that the other way. I mean, we should basically make the maximum out of these machines to solve our problems. And basically, here I can cite an example. For example, ChatGPT. Is it helping us, or is it basically making us lazy, or is it basically destroying our creativity? That's a question, a debatable question. Right? So what I believe is it's not a bad thing at all to use ChatGPT, but we need to be very sure about what it is providing us. We need to cross-check whatever it provides us, and so on. But so to sum up, basically what I believe is that there needs to be a collaboration between humans and machines, and humans and humans.
Mm-hmm. Yeah. So, Kim sir, since you are currently a PhD candidate in international health, so that's one area where collaborative work is very important, right? Networking mind is very important. So I will come to that part later, but before that, is our government AI ready? Is our government ready for the advent of AI and implementing the AI tools, AI policies in our government policies? Is our government ready for that or not?
Thank you so much. Again, very nice questions. Yes, we are already implemented AI technology and detected, I think, around 200 tuberculosis patients. We have the recently developed X-ray machines, which is connected with the weight is not more than this projector, and then it is supporting to the clinicians. It seems there is good collaboration, as Bal sir highlighted. It supports. It do not replace the physicians, clinicians, but it supports massively. And then, and we can easily move. This is portable and move even in the rural remote areas, and then it gives the effective result. So we are already ready and we are doing it, no doubt. And then we are eagerly waiting for other options. Then we have many challenges, many issues. If academia, some other inventions, innovations we could get, then always they complement for our issues. I think, in my opinion, this is my personal opinion, they couldn't replace. The sense, human sense, is always on the super level. So once some sort of innovations, the knowledge comes, then our super mind again becomes super. So always we handle these things.
Okay.
So welcome all these innovations, technology. I'm really proud and very happy to receive and to get to know these things in my life.
Okay.
Maybe it would be late.
Yeah.
Yeah,
Okay.
if I was born before 50 years.
Okay. So you mentioned that the government is already implementing AI in certain areas, probably in the user end, not the developer end. My question is, why government agencies are always late comer when using the technology? Why? Because industry catches the technology first, okay, and then academia catches around the same time, right? But the government agencies it feels like they are always late in adopting technology in their day-to-day business. Why so? Why government cannot be the first actor in technology?
Actually, I don't have answer for this question. We work together with the politicians, and then industry is more free. We have the political, the sphere, though we have resource, but maybe we have to also admit industry, academia are also nearby with the government. But the priority, I don't know, if we take the example of US, there are so many innovations. Industry, for example, we can take the example of COVID vaccines. If, it was so tight like in the European Union, I think it would take more time to innovate the COVID vaccines. So I think there should be liberation, some sort of openness to compete for the innovation. So I think in government, there are set of assigned activities doing work in a format, certain algorithm.
Okay, we got it. We got it. So it's lack of openness.
Yeah.
Okay. Yeah.
Yeah.
So Professor Bal, since you mentioned that you are working in NLP and working with Tamang language, Nepali language, and English language, right? So the algorithms we are using right now, they are trained in English. The algorithms are trained in the interest of male white European. So that's why artificial intelligence is gendered, artificial intelligence is racist, and artificial intelligence does not represent the minorities. That's very big issue. I think AI field is being criticized for, right? So for a resilient future, I think we need to make artificial intelligence, or we need to make any technologies for that matter, inclusive also, right? Free of biases. So are we working towards that direction? Is your field working towards that direction to make the IT industry or the artificial intelligence industry more inclusive, not only in terms of the worker, but also in terms of the algorithm itself. So are we working on that or not?
So, as I mentioned earlier, without data, we cannot really imagine any artificial intelligence technologies and so on. And you rightly mentioned all of these, basically, these models are basically, trained for high resource languages like English, French, Russian, German, and so on. But the problem is basically, I could relate it with the keyboards, Keyboards basically is Remington and everything. Basically, it comes with English letters or other letters in other symbols in other languages. But what we basically do is we map those keyboard layouts for our own language and develop keyboard drivers for our own language, so that as you type, we can basically type in Nepali Unicode and so on. It's the same thing, We should adapt or adopt technologies. These are essentially pre-trained models or technologies, but at the same time, we need to fine-tune that model or technology to the best needs, as per the needs of our own language. That would mean developing our own data sets. That would mean developing or tweaking the algorithms that would actually cater to the needs of our language, and not necessarily following the algorithm that's designed for the particular language. So with that note, AI is being democratized largely in the recent times, and with that there is an advent of this multilingual models. So Nepali is a little bit closer to, let's say, Devanagari script languages like Hindi and Marathi, for example. Not as close to English or other languages, because we have a different word order and different grammatical structure and so on. But what we could do is basically develop more and more of these multilingual models, and then feed in our own data, Nepali or data in our respective languages, so that our needs are fulfilled. And the other thing that I tell my students is basically don't treat these models as a black box. You need to, as engineers, you need to basically, be familiar with the underlying mathematics. How are these operating? What are the underlying models and methods and so on? Without basically knowing how these operate, then that would be like using it as a black box, which would not lead us anywhere. We are just parasites. We are just consumers. So in doing so, we basically need to tweak these models as per our needs, develop more and more multilingual models, and so that all the different biases that are inherent in the model or the data could be rightly addressed in our system or in our models.
Okay, thank you. So, do we have, Kim sir, do our government or governmental agencies have any policies and policy implementation? What is the condition, what is the status of policy implementation to promote the resilient future of the citizen of the country?
Yeah, it's very top priority for the Ministry of Health and Population. In our strategy, it is written resilient health system. I think who have already referred the Nepal health sector strategy, resiliency, quality, equity, accessibility, adaptability. We are very used to know these words. So really, after the COVID pandemic, the word, and then earthquake, the word resilience, I think who are working in the health sector, they have heard many times. But the question is how we are, preparing and responding in line with the resiliency is the question. Because we are in a low income resource, poor resource setting, and we have so many issues, problems in health system itself. So there are so many things to be resilient in terms of equipment, infrastructure, capability of the workforce, the community, and then the geography, in terms of many dimensions, we have to be prepared. There are so many things to work, but at least we have been oriented, being aware, so that our coming generation should be, should work should be, in the similar conditions what we are enjoying in this earth.
Okay, thank you. We will go to the audience, to the floor now. Please briefly introduce yourself, and if you have any comment or question, if you have questions, questions to be addressed by two of the panelists, don't ask me, two of the panelists. Please, the floor is open. Mic लिएर हिँड्नु पर्ला. Okay, you will start, yes.
European Union, I should introduce myself. I'm Nirajan Dakal, and a student of BIT program in Gandaki University. And I also practice artificial intelligence as a student, and I am ML engineer at DRCFS, which is a student community organization. And as recently seen in European Union, they passed AI Regulation Act, and the need for regulation is must, as I see in this country, because in the trend of last 2 years, Nepal has been shown into the ranks of top 5 position that uses artificial intelligence systems that they need for their improving their productivity. But along with such systems, there comes biases, as we mentioned, and as if we work in such algorithms, we know obviously. So with such biases and such problems, we need to create some regulation policies and protocols such that such systems should align to our needs also, as we are minority in the worldwide community. So I would suggest government agencies to work on creating and formulating regulation policies and protocol, and also need to take care about data privacy as well as improve common everyday necessary tasks by automating them, but keep human in the middle.
Okay, thank you. Thank you. It was a comment, not the question. पछाडि हात उठे जस्तो लागेको छ, झुकिएर उठेको रहेछ.
This is Nafisha Mirin, currently reading BPharm third batch, and I would like to ask one question. How can we integrate AI and health in current situation of Nepal? What are the challenges that we could face in further days, and opportunities as well?
Okay, thank you. Thank you, Nafisa. केही क्वेशनहरु कलेक्ट गरौँ, त्यसपछि कलेक्टिभली एड्रेस गरौँला.
Any more questions?
Question, comment? यो सेक्सनबाट चाहिँ छैन. Okay. I think this question was for both of you, integrating AI and health. Okay. One short note. This panel discussion, we had one expert, one panelist, supposed to be one panelist from sustainability also, because we had One theme, networking mind, right? And another theme is resilient future. So networking mind is not only the human mind. We were talking about artificial intelligence also. So networking the intelligence. And another is resilient future. The resilient future is not only for health, the resilient future for sustainability also, climate also, right? So unfortunately, our third panelist could not join us. So our discussion today focused only on two issues, the intelligence issue and the health issue. Yes, please.
Thank you for the question about how AI could be implemented with health. So basically, there is a lot of things that we can do with the health data. One of the things could be predictive data analytics. So, if the doctors or medical persons were basically given some heads up after some data analysis what the possible disease could be, then it would be of big support or help to both the patient and the doctor for further following up with further medications and all. And there are several others, other advantages or benefits that you can do, that you can basically reap with the application of AI in health sector. And for that purpose, the Kathmandu University, we have started this health informatics program both in the bachelor and masters. So we are in the masters, we are already running third batch, and for the bachelors we just started this year. So with that 4 years of education in health informatics and 2 years of education in the master's degree health informatics, we intend to basically combine or fuse the informatics with health, and with that, come up with some very useful data analytics that would be useful both to the patients as well as the medical doctors. But one of the crucial issue here is about the data, because the data is with the hospitals, and it's always a problem to gather those data, citing privacy concerns and so on. And with that, there was an earlier comment on this AI policy or something, and I just wanted to add in information that the government is currently has released this AI policy concept draft for public feedback, I guess, and I believe we will have a sound AI policy which will be basically which will basically come out very soon in the near future, which will basically hopefully consider all those different privacy concerns and issues, and how our AI technologies and so on could be free from these biases and unfairness. So that's how I would like to answer to this question about AI and health. Thank you.
Thank you for the question. As I already told, the predictive, the modalities, the analytics we can use, for example, in health. We can take the example of the pharmacy, the drug. For example, if we have the real data in our service delivery point, we can predict what kind of drug we are consuming more, and then we can reduce the cost. Only the needed amount we can produce and we can send. This is the good example. The forecasting, the quantification we can use in the pharma industry. Similarly, the universities, the international universities, they are currently working on AI technologies. For example, by the use of the electric current coming from our brain, we can predict whether the epilepsy, what is the chances of epilepsy or not. So, there are so many things happening in the international community, but we are, I think, far behind. For example, our master thesis, PhD thesis should be in line with this. It is always for, helping for us human. So we have to integrate, incorporate, and we have to prepare the policy, protocol, regulations. Maybe everything comes after, the market guide us. And based on the market scenario, we have to prepare these things, and then we have to work in collaboration. So I would like to request Bal sir to collaborate with the Gandaki province, at least with the health team. And then health informatics is there. We are facing problem here. And then our Gandaki University also, we sit together. And then we are very happy to collaborate. What kind of project we can initiate for the future sustainable system that would not happen, that wouldn't abort in between. Maybe the development and generation part, you lead it, we operate it.
Yes, thank you.
Obviously, we collaborate in terms of finance, in terms of knowledge, in terms of issues. I would be very happy to collaborate, or sign some sort of agreement with the Health Informatics, Kathmandu University, Gandaki University, maybe Pokhara University. That would be the future, scalable, sustainable project. Why? For example, we are depending on the Oslo University for DHIS too. Why? Why not? Like the intraocular lens. Let us develop some sort of the mechanism, tool. I think this discussion will help us to do certain new things.
Thank you.
Thank you so much.
Thank you, sir. So, I think our time for panel discussion is almost over. In this panel discussion, we discussed many issues, especially on networking minds and resilient future. So for a resilient future, we need a very strong collaboration. Collaboration, what makes human unique species on Earth. So we need to collaborate more. The collaboration can be between industry and academia and government. And within academia, we can collaborate between various disciplines. So interdisciplinarity is the key word for collaboration, and collaboration is key for resilient future. And collaboration is itself a networking mind. So with this, I would like to thank all the audiences, and special thanks to our panelists. So this concludes our panel discussion. Thank you.
Thank you for the panel discussion. Now I'd like to request Dr. Kailas Timilchina, Registrar of Gandaki University, to provide the token of appreciation to Professor Dr. Balkrishna Bal, Mr. Khimbahadur Kharka, and our moderator, Dr. Kapil Adhikari. So Professor Dr. Balkrishna Bal, so one of our panelists. So we highly appreciate your participation in this conference. We have Mr. Khimbahadur Kharka, our next panelist. And we have Dr. Kapil Adhikari, Dean of Faculty of Science and Technology, Gandaki University. Thank you, Registrar sir. Now we will immediately move on to our first session of the day. So I would like to request all the participants for their enthusiastic participation in the scientific session. Thank you. Yeah, okay. So there is one notice for all the poster presenters. So the poster evaluation is going on. So I request all the poster presenters to be with their posters, respective posters. Thank you.
म आफै पनि